Welcome, everyone. So we're here for a topic that I've become really passionate about, which is working with trauma, but specifically working with complex trauma from childhood, where we're hearing that it's also called attachment trauma these days. Because what we see with complex trauma is it's an experience with PTSD, but then it recurs over and over again. And why it's called attachment trauma is it's usually inflicted by a caregiver, someone that you expect and hope to be a safe space. And then when that doesn't happen, it becomes very wounding on many levels of development, a sense of safety, social development. So I've become really passionate about it. And I've actually started to specialize in working with trauma. I've made this shift in the past year. Many of you who have followed me and know me know I've specialized in working with postpartum women. And then I shifted to working with OCD. It became a love of mine as well. I've had an identity crisis in the past year. I was like a postpartum therapist, then I became an OCD therapist, but I really think I found my passion in trauma work. So that will be my identity for a little while at least, is being a trauma therapist. And I saw a lot of trauma in working with OCD clients as well. And so that surprised me. While we know that's not like the cause or a common link in OCD, it's a complex process. It seems to really play a big part. And then in diving into working with my OCD patients and wanting to also help treat the trauma piece, I've become just really passionate and interested in it. And I am excited to share a few tools with you that have really resonated with me, that I've seen also help really create a lot of healing work for these people. Okay, so for those of you who don't know me, my name is Tyann. I am in private practice in Oklahoma. I am also a certified TEAM-CBT trainer since 2018. Actually, I love TEAM-CBT. It'll always be my first love. I love integrating ACT components of like values work and really looking at action and steps that they can take with the behavioral changes. And then I've also dived into IFS and trying to work with complex trauma and attachment trauma. And I'll share some of those components with you as well. And I'm a mom of two, so I usually update all of you who've attended my webinars on how my girls are really growing. So this is Eiley, my youngest. She's turning 4, and Tavi is turning 8 in just a couple of weeks. So in March and April, they're just really growing up. And it's definitely been a ride, a journey through motherhood. And it was my journey with Tavi actually going through pretty severe postpartum depression, suicidal thoughts, a lot of hopelessness and struggles that then drove me to actually open my private practice and be a resource to work with the postpartum population. But I guess I've outgrown that. She's almost 8 now. I'm 8 years removed from that experience, and this is now my next chapter, working with trauma. And I've been married. We celebrated 10 years last year, and we've been together for 15 years. We actually met on Valentine's. So yesterday was our 15th year anniversary of meeting there. So that's a little bit about me. And I'm going to dive into giving you just a brief overview of TEAM-CBT. Most of you are already very familiar with TEAM-CBT. And so I'm mainly going to focus on the 3 methods for today. Okay, but I'll give you some resources if you want to know a little bit more about these other components if you are new to TEAM-CBT. So TEAM-CBT is a structure for therapy. It's a framework that was created by Dr. David Burns. And we find that regardless of whatever methods that you end up using, whatever modality that you end up using, if you make time to work through this framework, it can really increase the effectiveness of it. I still am amazed at the power of TEAM-CBT as I'm learning different modalities, that once I add in these components of TEAM, I find the tools to be even more powerful and effective. So I'm just really appreciating Dr. Burns and his brilliance and really wanting to give him a lot of credit for this process. And so TEAM is an acronym, and they're the key components that we find that can really help to enhance the effectiveness of treatment. And first, the T just stands for testing, where we do outcome measures, we measure symptoms. And I find that in some of the modalities that I've learned, if they don't measure the symptoms, we don't really quite know if it's been effective. And even if it's only measuring at the beginning of a 12-week treatment and at the end, we can see overall change, but doing it every week like we do with TEAM has allowed me to see, oh, we're really stuck this week, or this week symptoms have actually worsened. And then I can troubleshoot and actually be even more effective in the treatment process for them. So we can troubleshoot along the way. When working with trauma, I do like to use the PCL-5. That's the trauma checklist. I've shared about that during the written exposure therapy webinar, and I've attached the link here to the webinar if you wanted to learn a little bit more about it. And that just helps us to assess how much their trauma experience still impacts their symptoms today. If there's PTSD, 31 to 33 is the cutoff point for being positive for PTSD. And then we'd love to see that be decreased. So you can do it in the middle of treatment, at the end of treatment as well, to also really assess for trauma symptoms. And in TEAM-CBT, when we use the brief mood survey, we'll start to see shifts too in depression, anger, anxiety. Positive feeling starts to increase as well. Okay, and then the E is empathy. I feel like our empathy skills just really enhance connection and a sense of safety for clients. So a place where you can just learn the 5 secrets of effective communication would just be the Feeling Good podcast. The Feeling Good Institute has a couple of great trainings that will train you in empathy. There's the Deliberate Practice group. There's Mike's group as well that does great, just allowing us to learn about it, but also actually practice it and get feedback. And that's actually the best way to learn. And I could send you out some other resources. Brandon and Heather put on excellent trainings on the 5 secrets of effective communication. And if I could say, if there was one tool that has helped me the most in my personal life, it would probably be the 5 secrets of effective communication, especially with disarming and really working to see the other person's truth. I found that to be completely life-changing, not just in my work with clients, but in my personal life. So I highly encourage that if you're not as familiar with TEAM, to find resources to learn the 5 secrets of effective communication and to practice it. And then that leaves us with the A, where we're addressing resistance. We invite them to do the work. They can choose to share more if they need to get more off their chest, but they also know that we have this option here that has active work, it has tools, it's a different way of functioning that can help them get the changes that they're looking for. So we give them that invitation if they would like to move forward with learning some tools that can help them get the change they're looking for, or did they need a bit more time to share anything else with you? And I find the invitation to be so respectful of just honoring where they want to go, and they get to choose when they're ready. And sharing and having someone just help them process some heaviness and some struggles is also super valuable. And they get to choose if they need a bit more of that as well. And then I'll transition into the float back technique with you all, and that will address some specificity. But specificity is just when they actually choose a problem they want to work on. We give them some options. You have shared about having struggles with depression and feeling down about yourself. You have shared about struggles with anxiety and panic. And then you also shared with me about this trauma history where you still feel really stuck and it still really impacts you. Is there one of these areas you'd like for us to begin to work on, or is there something else that I haven't mentioned? And we're imagining that they're choosing to work on their trauma during specificity, and that's when we'll address motivation. I'm not going to go over motivation since I went over it pretty thoroughly in the written exposure therapy webinar, but you can just go to this link and it's time stamped. And so in the handouts I sent you, if you just click on that, It'll take you straight to the addressing resistance section, where I share with you how we address process resistance with their desire to avoid, which is very common. When you've been traumatized, you want to avoid those memories. You want to avoid the images, avoid the feelings. It's excruciating, it's torturous to go there. So naturally, they want to avoid, and we want to honor that avoidance, see all of the good reasons to avoid and why they would want to move forward, considering how protective it is to continue to avoid. And then I also share with you a demo in that webinar of how to bring that to really help bring that to life. I demoed that tool with you all. And then it also talks a bit about addressing outcome resistance. What are the good reasons to hang on to some of your symptoms, like hypervigilance, arousal, flashbacks even, right? And then this dives us into methods. So this is going to be the 3 methods that I'll be working with you or sharing with you on for this healing process. Okay. So I'll share with you some of the tools and then I'll show you a video for the demo. And then I hope that you'll, oh, sorry, I accidentally clicked on that link. And then I hope that you'll benefit from some of the experiential exercises that I'll have by the end of it too. And just know you have a choice in this. If it feels like too much to dive into some experiential exercises right now, you don't have to do it. Just really listen to your body and your needs. And then if it feels like it's helpful for you to go through the process and see what it will be like in the client's shoes walking through these tools, then you're welcome to join us on bringing the tools to life through some experiential learning and doing some of your own healing. Okay. All right, so the float back technique, this is taken from EMDR. EMDR was actually the first modality that I was ever trained in. So in 2012, I was working in residential treatment with women in addiction. So it was a 12-month treatment program for women who had minors, and many of them had already lost rights to their children, and they were working to regain their rights to taking care of their kids again. And what we found in this population that had such a severe addiction, they may have come out of prison, they've lost their children. They also suffered from severe trauma. And it was some of the worst cases that, even as I'm thinking of it right now, it's painful to think of some of the things that these people have been through. You know, some people have grown up with addictive parents who abused them. Some were just still can't wrap their head around why they were sold for their parents' next hit of meth. Like it gets to that point where the violation in a sense of safety and being able to trust another human being, especially your caregiver, was just so deeply violated. And I found that EMDR was powerful for some people and not for others. And then after I was removed from that setting, I worked in a short-term treatment and really didn't have space to use EMDR anymore. And then, of course, I learned TEAM-CBT and loved it so much. And then in learning just these more active approaches, I find that my preference now is having more active approaches instead of sitting and observing someone engaging in eye movements and reprocessing their trauma. But I just want to say I still appreciate the approach. I have seen the healing power of it. And this is still one piece from it that I still use to help people find a target memory to work on. Okay. So those of you who are familiar with TEAM-CBT, you'll see there's a lot of alignment with specificity. And on the treatment plan, we would just then have the client first identify an issue you want to work on. And I want you all to think about this for yourself and begin some of this experiential learning. If you have a notebook, something to write on, or if you are just typing, just begin to identify an issue that you want to work on. This is something that, as I'm connecting with, it needs some of my attention. it's something that may feel a bit heavy on my heart, and I just want to work on it. So we have clients, let's first identify the issue you want to work on. You've shared XYZ with me, and which one would you like first to begin with? And then once they identify the issue, just like in TEAM-CBT, we go to level 2 of, can you identify a recent moment in time when you struggled with this issue? And I'll have you all put that down as well. Think of an issue, think of a recent moment in time when you struggled with it. And usually if someone has had a trauma history, this float back technique can really help them to track the current problem and moments in the past when this problem has been recreated or reactivated over and over, right? Dr. Burns calls that fractal psychotherapy, where these fractals often represent a moment in time and is a very similar issue. And once we work on one of those moments, it starts to create healing for the whole network. And EMDR believes that as well. A present moment issue, if you can trace back to when it started or when it was activated, healing any one of those moments starts to heal the whole network. Okay. And what I see with this tool is it just starts to help people have insight, create links in their struggles. And then it also helps them to have a list to choose a target experience to work on. And so with the float back technique, we just say something along the lines of, as you bring up the recent experience that you just shared with me, notice what images come to mind. Notice any negative thoughts or beliefs you have about yourself, because you'll notice those messages are pretty similar each time they're activated, right? Like, I'm gonna fail, I'm not good enough, etc. Notice what emotions and body sensations come up. Now allow your mind to float back in time to an earlier experience with a similar sense. And so just let it float back. And it's helpful to list it out chronologically, actually. And so when you float back to the moment previously, to that earlier experience that gave you the similar sense, put down about how old you were, and then just briefly what that event was. And then once you have that in mind, keep going. Let's continue to float back in time. Any earlier experiences with a similar sense? Anything else come up for you? And then once I do that, I'll see a client had, oh, what I'm wanting to work on is this traumatic, recent sexual abuse experience, basically. And then I'm floating back and I remember, oh, when I was 17, this happened with a boyfriend that felt really violating and inappropriate. And then when I was about 10, XYZ happened, and I felt really inadequate. And then before that, it may not have even been tied to sexual abuse, but it was a moment when I felt unsafe, not cared about, not treated with respect, right? And then just have them keep going. Anything else? Can you think of anything else as you allow your mind to just float back in time? And then as you see the list, you start to see like, oh, this creates the links. And the later moments in time may sometimes actually be amplified or influenced by all of these past pains because it's been stacked. And then it just begins to give people some insight about this process, what's been linked, what feels really similar. Some people are like, oh my gosh, I didn't even realize this feels additionally painful, because when I was 4, my dad left and then my mom was just absent. And then I also felt like just no one was there for me, just like during this rape experience for them. Right? Okay, so that's the float back technique. I hope you had enough time to just experience that for a little bit and to track back for your own self what links can be made. In EMDR, they believe it's just the same network that gets activated, and all of these moments link it and then activates it again. And then a modification that's been recent is called the affect bridge. So you may find actually about 20% of people struggle with imagery Sorry, I just realized that's a typo, imager. They struggle with imagery. And so they may have a stuck point when you say, notice the images, think of the memories. And so instead of saying, notice the images, you just have them hold the experience in your mind. So as you bring up the recent experience, hold the experience in your mind and notice the emotions that's coming up for you. Notice any sensations you're having and allow yourself to scan back to an earlier time when you experienced something similar. So that's just another way to do the float back without the block for someone who's really struggling with imagery. And they find that about 20% of people are not visual. They're not able to actually close their eyes and see a visual of the past or what's going on. Okay. And then from there, in EMDR, they talk about what seems to be most impactful in the healing is for them to do the work on the first or the worst memory that they've had. And so, whichever one that feels still most activating, that's the worst, or whichever one from the list, that's the first. But I just want you to know they can actually choose any of them on that list to target, and targeting one can help to heal a lot of components in that same network there. But just a rule of thumb, the first or the worst usually seems to create the most healing for people. Okay. And then the second tool is time projection. This is the one I'll show you a video on, where I demo it with a woman named Carmen. Just really appreciating Carmen for giving me permission to share this work and being vulnerable. She said, I've benefited so much from other people's vulnerable work, so I want to share my works in hopes that it could benefit others in their learning journey as well. So I'm just really feeling a lot of appreciation for her and her willingness to do that. And in time projection, I've given you all the handout. I'll show you the video, and then I'll also have you do an experiential learning of the tool and have you walk through it as well as I guide you through it. So in TEAM-CBT, we have past time projection and future time projection. Time projection is just your current self goes back and connect with that past wounded part. Or the future time projection is you can see a future self that's in a better place, that's in a better state, coming to the present to connect with you. So in TEAM-CBT, we already have those components. I find that IFS and ACT has really helped to flesh out this tool for me. And so you'll see in the current time projection that I'll share with you, it has some components of the inner child work of IFS, and it's also greatly influenced by Dr. Kelly Wilson. Stephen Hayes gets all the credit for creating ACT, but Dr. Kelly Wilson has been a big part in co-creating ACT. And I learned this tool from him in attending the ACT boot camp. And then I feel like some of the IFS components that's been added has helped to enhance it. And so I'll share all of that with you. Again, the script is in the handout that I've sent, and then I'm going to share with you the demo right now. And then we'll go into the healing space. Okay. Yeah, I did this process for myself, just going through that imagery, and because it was so impactful for me, that was when I thought like, oh, I'd really like to refine this and combine with what worked. Because when we learned it in the ACT boot camp, we were just to leave the child from the time projection, and that just didn't feel right to me. Like he said, okay, now just let them go and fade back. And I like from IFS where they actually retrieve the child if they want to. You ask them, you ask for their permission, but it feels so much better than just, okay, you've connected with them. Now leave them still in that space where their mom yelled at them and unleashes her anger. And so I really like that component where it feels just like it gives them that corrective healing experience that you don't ever have to go back there again. I'm going to take care of you now.
Yeah,
And that impacted me personally. What is it, Maria?
yeah, it was like a full circle, it was
Full circle. Yeah,
yeah.
exactly. Okay, I think there's a couple of other questions. Here, any difficulty with most clients keeping their eyes closed for that long? I don't actually tell them to close their eyes. That was just her choice. It seems like when they just go into this and they're trying to connect with that past wounded part or that past self, a lot of people find that closing their eyes just helps them to connect with that process. That just happens. I find that happens for me too when I'm doing personal work in this process where it just feels like I really want to connect, and the way I can visualize is through closing my eyes. And that just happens. It's not an instruction that I provided. Um, Only once I started having a client who said, okay, I'm going to close my eyes. Don't think that's weird, but that's helping me. Then I started to give them instruction on you can close your eyes if you want to. Do whatever feels right for you, but you don't have to. So hopefully that answers your question, Sean. Okay. Okay. Another question here. Okay. You mentioned that many of your clients who suffer from OCD have also experienced trauma. Have you found that doing trauma work can increase OCD symptoms or addictions or other unhealthy mechanisms? If so, how do you address this? Um, I often find the opposite, actually, because we may see that they have these responses as a way of coping. So, whether you said there's addictive processes, they're turning to compulsions, it's their way of responding to some stressors if it's related to trauma. And then I find that if we work to actually heal the trauma, that anxious part that's like terrified to die or terrified to harm someone or terrified of that they can't trust who they are and that they'll be a pedophile, that actually becomes less extreme. And so some of this inner work with the trauma seems to actually decrease intensity of symptoms or even the urge to numb out or cope through drinking, etc. And so I'm not always like when working with addictive processes, a stickler about we have to work on the addiction first before we work on healing the mood or the trauma. I just ask the client what feels right to you, what feels like it's more pressing. And their system often knows like it feels right, like I think I need to address this. So I'll be doing some like ICBT work for OCD. And then we found, oh, a vulnerable self-theme is I'm actually afraid to be a selfish, irresponsible person. Oh, I'm realizing that's who my dad was. I'm terrified of becoming him. Then I would ask them, like, I'm hearing you're connecting with this trauma, and this is tied to this feared self that's come up for you. We can continue with the OCD work, and that's helpful for a lot of people. Or does it feel helpful to pause and do some of this work around how your dad's impacted you and some of the trauma that's come up around that? And then if they choose that, I find that it helps to like gain insight. They're less likely to fear that they're going to become that bad person, and then they have less of those and those thoughts, the what ifs and the doubts about um, who they could become or the mistakes that they could make. Right? Does that answer your question there, Lorna, about the OCD? Yeah, thank you for that. Okay. Oh, I'm realizing it's a direct message. Is it okay that I read it out loud? The questions there for the recording? Okay. I have a question regarding the role play. Request to see the little face of your loved ones, asking what you want them to know. Is this seeing them as children, or could it also include speaking to them as adults? Um, in in the ACT boot camp, what he did was actually seeing their little faces as little people, as younger people. And their rationale for this is it helps with perspective taking. It also helps with empathy. Empathy is the antidote to anger. Compassion can be the antidote to anger. And so they're seeing their loved one's face. She's had a disconnect with siblings, with her mom, um, and just all of the people. And so we're wanting to do perspective taking, see their little faces as young people, as little people who've been through things, taken on these burdens because she shared about her mom's own trauma history, right? So she could see the young mom, the little version of her mom who was abused and probably had no one there for her. And then when you ask them, let them know what you want them to know. That again is just another form of let me connect with empathy and compassion. And often when we can do that, it's an antidote for anger or frustration or resentment that we've been carrying for them. Yeah. Greg, affect bridge. It comes out of the hypnotic approach. Oh, really? Gil Boyne. Okay, that's good to know. I'm sure Francine Shapiro, who came up with EMDR, probably captured lots of different pieces and learned from different things. I've done some brief hypnosis training as well. Gil Boyne is a real character. And so that's interesting that came from him. So he's done the affect bridge. Judith Beck also talks about the affect bridge in CBT. Okay, that's awesome. It's good to learn. I've never been trained in traditional CBT, so I didn't know what cognitive restructuring was for a long time. Like I had a client who was like, "No, cognitive restructuring is going to be enough to, change what's going on for me." I was like, "What's cognitive restructuring?" Because she knew I was a CBT therapist, but in training through TEAM-CBT, we actually don't ever really use the terms cognitive restructuring, right? Okay. Sue, do patients ever feel too upset to go back to traumatic past events? Oh, definitely. This is where we're talking about, we don't just dive into the tool, right? I hope you hear in the overview of the TEA is I'm first making sure I make time to really connect with you, make sure you feel safe. And then we do a lot of work in addressing resistance. I think this is the power of TEAM-CBT is the heart of it is let me not just throw a tool at you. Because if someone's been through trauma, it would be terrifying to just throw them right back into that time. And sometimes they find that could be the fault of EMDR, that we go straight into retrieving and accessing a really vulnerable, scary part, and their system's like, I'm not ready. This is too much. This is terrifying. And so in our resistance work, we look at what are all of the good reasons to continue to avoid this, right? Let's list that. Let's empathize with the part of them that's really scared. And let's rate motivation to do this work. And so if they're at a 50%, I'm not going to throw those tools at them. And then if they list out all of the good reasons to continue to avoid, and then I ask them, considering it's scary to go there, why would you want to stop avoiding and to actually do this work? And then they're the one that convinces me that they want to move forward. It is scary, but I've been living in fear for 40 years and it's time to heal, right? And then they take on the reasons why they want to move forward for change. And once they do that, and I re-rate motivation to change or to move forward with the work, to do the healing work. And usually I aim for only when it's like well above 60, at least 70 in that safe space would I move forward with the change. Because there's cost to doing the healing work. And we want them in their own voice to share with us why they want to do this, why approach the fears. And there's a lot of other steps to the resistance that I hope through the link you can gain more insight. So just look at the link for the written exposure therapy webinar, and you can look at other ways we address resistance as well. Okay.
Can I just briefly throw in the reason I brought up Gil Boyan and the affect bridge? It was in response to an earlier question about is this
Oh,
hypnotic? And I'm saying yes, yeah, in many ways it's
mm.
very hypnotic. It's just a lot of time had passed, and so I realized all of a sudden maybe that
Oh,
simply in
okay.
context that I would make that comment.
Yeah.
That's why
Um,
it's like, yeah, there's a lot of hypnotic work embedded here, whether
mhm.
you call it formal hypnosis or not.
Mm-hmm. Yeah, so good to see you, Greg, and appreciate your insights about that. Yeah, you do see the hypnotic processes in it, and anytime we do any guided imagery, we see it does tap into maybe a just a different level of consciousness for people, that it's not all just like thinking and heady in that process, right? Yeah, and I wonder if too, for some people, if that's where it gets into just a different level, another level of healing for them. Okay, so I wanted to leave about 10 minutes for the Q&A, and then I wanted to make enough time for the experiential learning as well. Okay, so let me wrap up with this last question from Laura. Did you mention written exposure therapy? Where is that? That was in my PowerPoint slides where I shared with you that link. You can go back there to watch the whole webinar. It's a really like simple but effective, awesome approach in treating trauma. So I just highly encourage it if you want to watch that webinar, and just have another awesome tool that could be helpful for your clients in healing this process. It's very meaningful work. Any other last thoughts or questions before we go into the experiential learning, and then I'll share with you the healing place. I thought I heard something. Okay, maybe not. All right. Are you all ready to dive into walking through this for yourself? And to just see what happens for you. And again, I just want you to listen to your body, trust your own system in this process. If this doesn't feel like the time and place to do what you had witnessed with Carmen, then listen to that. And then if it feels like, oh, this could be beneficial, I'm curious where this could go for me, then you could follow along. Okay. All right. Let me pin myself again for those joining for the recording. Okay, we're diving into time projection. So for those of you who had tried, did the float back or the affect bridge, go ahead and choose one of those moments that feels like it could possibly be helpful for you to connect with that moment in the past, that younger version of you. And it doesn't have to be a child version either. It could just be a younger version if that's the moment that feels like it could be most helpful for you in this work, okay? Okay, and you can definitely choose to close your eyes if that feels helpful for you to connect with that. You can also just have a soft focal point and leave your eyes open if that feels more comfortable too. So, time projection is a tool that can help us find a past wound, one that still impacts you today, may still make you more reactive today. And working to find these wounds and to heal them can also help to heal our reactive responses, whether at moments we get more angry than we'd like, anxious about abandonment, fear of rejection, get controlling, become clingy. Doing this work can help to heal some of those extreme responses. And I'm hearing a little bit of background noise, so I'm just going to go ahead and mute everyone. And if you're checking out with your system and you feel open to trying this, then you can follow along. So go back to that moment that you have chosen to connect with a younger version of you who's likely stuck in that time. Connect with what are some of the beliefs that you had taken on from going through this hard time. Just connect with one or two of those thoughts and beliefs that you had to take on. This is what we call burdens. We all carry some burdens from our past hard life experiences or challenging experiences. Think of how much you still believe in that thought today, 0 to 100. And when you connect with those beliefs and those burdens that you've carried, what feelings come up for you? You can always look at a daily mood log as well to connect with those feelings. But just one or two can be helpful and rate how intense those feelings feel as you connect with that belief, that burden you've been carrying around. Okay, and if it feels right to you, we're going into past time projection. Or I'm going to have the core self of you go back to connect with that younger version of you. See the face of that younger person that experienced this wound in the setting when this message became true about them. See how you feel towards them. If you're feeling anything other than compassion, curiosity, connection, see if you could have those other parts of you relax back a little bit, if they're willing. So if you're feeling anger, annoyance, disgust, anything along those lines, see if those parts of you would be willing to just relax back a bit so you can just connect with this younger version of you and help them heal, just to understand them a little bit better. Okay, and see how you feel towards them now. And if it feels like you're in that more compassionate, open-hearted, curious space, then allow yourself to continue. Okay. And if you're not in that space, that may be your system's way of saying, not quite ready to do this, and that's okay too. Really listen to that. Okay, as your core adult self approached your younger person, and be with them in the way that they needed and wanted someone to be there. Look at their face. If they're comfortable with it, see if you could lean in real close to just whisper in their ear, I know. I know how hard things can get, and I know you. And tell them anything you want them to know to carry them forward. And take the time you need with this younger person, the younger version of you. And when it feels right, step into the perspective of the younger you. From their eyes, look into your eyes, the adult that has been talking to them, the adult that knows them, the adult that's the compassionate presence. Experience what it's like for them to feel seen and to be known in this way. How does it feel for them to receive these words from you, to have you be there with them in this way? Okay, now become the adult again, the core self of you, and ask the little version of you, the younger version, if they'd like to come with you into the present. It's totally up to them. You can also take them to another place that feels better for them. Could be a real place, could be a fantasy place. And if they're ready to go ahead and fly them to that place, to the present with you or any place of their choosing. Let them know they never have to go back to that time and place ever again that they left. And you're going to be with them to take care of them from now on. And just look at their little face, their younger face, and see how they respond to that. Okay, let your system know we're shifting gears a bit here into future time projection. Now see an older, wiser version of you who's come to you from the future. And this older, wiser self is free. We don't have to think about how they've gotten there. We just know they're free and they've done all the things you've wanted to do. And they're coming back in time to talk to you. And your older, wiser self is with you in the way that you need and want someone to be there for you now. They also get real close and just whisper to you, I know it can get hard. I know it can get challenging. And I know you. See your older, wiser self tell you anything else they want you to know to carry you forward. And really take it in. As you take in what your older, wise self has to say to you, connect with how it feels in your body to receive these words, to have a presence that just knows you. You'll see your older, wiser self fade back to the future and expand your perspective to see all of the little faces, the younger versions of your partner, loved ones, friends, all the people you know and all the people you don't know. See their little faces and the burdens they've taken on and have been carrying around for themselves. What do you want all of them to know? What's the message you want to give to them? Okay, and if it feels right to you, you can just take some time to send a lot of appreciation for the parts of you that showed up, your younger self, your older self, all of your loved ones, and all of the faces that showed up. When you're ready, we'll come back into the room and process this. Okay. What was that like for everyone? Any takeaways, challenges, anything that stood out that came up for you now that you experienced it for yourself?
I I found that I don't know why, but I think I know why, but I brought someone else with me
Mm,
instead of just like the self.
mm-hmm.
Like I brought like a protection figure,
That's great. Yeah.
and so it was kind of nice because I wasn't sure if I had like the energy or strength to like kind of prop up, like the confidence to prop up this wise self that's me. But so I sort of used the energy from a protection figure, kind of in
Mm,
that, so to speak. And that was really helpful.
mm-hmm. Oh, I
And
love that.
and then I just really appreciated at the end, like bringing other people to kind of like
Mm-hmm.
share the bounty that I got the
Yeah.
gift. Yeah.
What was that like for you to bring them in and to share the bounty?
Uh, well, I guess I didn't think of it consciously, but now I'm thinking of it like I'm not alone. Like I think of people that I'm close to, and sometimes how I can take for granted the struggles they're going through,
Mm,
and then that feels very isolating because then I think it's all me, the only one that's struggling,
mhm.
you know. Uh,
Yeah. There's power in connecting with the group and the other faces. Like, oh,
yeah,
they carry struggles too. I'm really not alone in this life journey.
right, exactly, exactly.
Mhm. Yeah, and I love your modification too, Don. I've seen that with, I think we've corresponded, like with feeding your demons, there's that ally work. When
Yeah,
you have an ally, you have a protector. That ally can be um, really helpful. And I actually bring that into the healing place exercise that I'll share with you all. But that ally, what you're talking about, could be anything. It's just a figure where they can connect with the energy of, for some people, it's like, I bring God in, and that resonates with them. For some, they bring a superwoman. For some, I've had them bring in like their grandmother. So it's just you're saying like when it's harder for me to just connect with, if I heard you right, like just a lot of pressure or for the self to be that wiser figure, we can also just have a companion that could be there with us. It's you and your grandmother coming back to visit the younger self. It's someone else that gives you some form of energy and protection. Right? Yeah.
yeah, exactly.
Cool. Thank you for sharing that. Yeah, I see some comments and thoughts in here that I could go through. Was there anyone that had any wish to share an impact or a takeaway through this? Any challenges?
I'll mention briefly. It was interesting for me because I don't have a big trauma that I wanted to focus on or anything. But I actually started with the experience of teaching last night in the class feeling really uninterested, which
Mm,
doesn't sound like a big trauma or anything. But it kind of stayed with me. And as I traced back, it really did kind of open up this whole thing about other places where I'd felt ignored by important people in my life and going back to childhood. And I just found it very productive, very useful, enlightening,
mhm,
and then to bring that care to those earlier parts of me, it just it feels really good. So I was kind of surprised by the impact of this, even with what I thought was kind of a trivial
mhm,
starting point.
mm. Yeah, thanks so much for sharing that experience where something feels trivial. I was just uninterested when I was teaching last night, right? And then realizing that was a moment that still bothered me, but if I trace back, there could be a core wound of moments I didn't feel heard, I didn't feel seen, I feel ignored by important people. That's painful. And it may not be big experiences of trauma, but I find that it could still be very enlightening for people to track back to these wounds. That's wounding when someone's important to you and they ignore you and you get messaging that you're not important, you're not lovable. Those are burdens that we carry that feels very painful and heavy. So I love that, Greg, that even through this process, it's trivial, but I'm gaining insight about me and why that still bothered me and what I've been carrying. And then giving, when your system's in that space where you can give compassion and care, we find that it just really starts to help, like create a corrective experience. It creates new neural networks for people, and it starts to create some healing and inner harmony for parts that may have just not felt seen and acknowledged. Right? Yeah, thank you so much for sharing that. Let me connect with some of the questions here. Do you find that sometimes the client can sometimes get stuck in grief while visiting the past? Definitely. I think it's healthy. You know, like if they go back into the past and they're like, man, I'm really grieving and I'm really hurting for this child that wished for a mother figure, that wished to be seen when someone was important to them and scoffed at them and ignored them. They grieve. And we really want to make a lot of space for that, right? You're hurting. Let's grieve for that child. Let's give it a lot of care and attention for its feelings, for its grief. And I'll share more about that in the future webinars with IFS, where we dive even more deeply, where they call it witnessing. Let me just witness what you've been through and make a lot of space to witness your pain. And when grief comes up, let's make space for that. What's coming up? What's showing up? Share and tell me about that grief. And then once we make space to witness them, just like in TEAM-CBT, once we make space for empathy, then it seems to start to get unstuck, and then they're ready to do the healing, the unburdening, do some methods for creating change, right? To get even more unstuck. Sonia loved visualizing a future self. Yeah, I love that too. Mine had told me, keep breaking the damn glass ceilings. Like that was my wiser, older self. I'm actually quite vulgar. And so my inner self, people are surprised about that because they're like, you're so soft-spoken. You seem so calm. But my wiser self's like, break those damn glass ceilings. And I still took that message with me. And it's continued to feel quite empowering. So I loved connecting with that too. Okay, there's a direct message. I'm not sure if you actually want me to share that out in the open. So let me know if you do. Sue, I had trouble with the older, wiser self being free. Yeah, you know, this is just a method, right? And in team, we just say it's one method. It's not the method. And if it's a method that doesn't resonate with your client, we let it go and we find other ways to work to make it work. And if it's harder for you to see the wiser self is free, that's why they have that prompt of like, we don't have to try to figure out how they got there. We just imagine that they are. And if that's a figure that they don't quite resonate with, you can do like adjustments with like what Dawn's talked about. It's just another energy, another figure that can come to you with some wisdom that may feel better for them. So there's modifications you can make with that too. I hope that's helpful, Sue. Maxine is saying, what if, did I miss something? Oh, what if the client cannot come up with the wise words? Yeah, if they don't have the words for it, maybe this isn't the best tool for them. Maybe there's other ways they can do that. Maybe they need a different figure. And a different perspective from someone who knows you and loves you, and it doesn't have to be your future self. And then if they don't have that, they can have an imaginary figure, you know, that they can bring up. And that also can create a corrective experience. There's other approaches where they create ideal parent figures. So it's not your future self, but if you had that ideal parent figure who just knew how to love you and be there for you, what would they say? What would you need to hear? How could they be there in the way you needed and wanted somebody? And that can be a really helpful way to do perspective taking, give a corrective experience, help them to get unstuck from that past. Okay, I don't want to butcher your name, but the question is, it was beautiful. I like wisdom from my future self, who said that I can bury all the evil things and take care of everything that brings life. It brought a sense of peace to me. Oh, that's beautiful. Yeah. So just like any tool, it can really resonate with people, and for others, it may not. We can look at ways to modify it, but when it resonates, it can be powerful in creating a shift, a sense of empowerment, a sense of peace, feeling unstuck. Okay, I've been given permission to share the direct message. I was surprised when I went back to my younger self, to the upsetting experience. The really upsetting part happened right after that. It was like I was avoiding a lesser upsetting event. I'm trying to understand, like maybe it sounds like maybe there was some insight that a more upsetting part came up after you went there. And sometimes that can happen in trauma work and challenging work. You're going back into a moment, but then it dives you into like, oh, this is what it uncovered. And this is another detail or a memory that came up for me. So it can actually create and uncover future, more insights, more details. Trauma memories are often actually quite splintered. So in written exposure therapy, they call it splintered memory. And when you do trauma work, it actually starts to help bring the memories together. It doesn't feel like emotions are separate from thoughts. And then it starts to heal that splintered nature of the way that trauma memories have been stored. And so sometimes when you go back into it, like, oh, new details are unfolding. And then I'm no longer numbing out because my emotions are now no longer splintered from the images and the memories. And it can come up in that way, and it can be surprising. And that's actually part of the healing process, healing the splintered ways that memories have been stored. Robert, anxiety and fear, even when we understand they are cognitive distortions, what are the ways to work? I'm trying to understand the question, even when we understand they come from cognitive distortions. What are the ways to work with anxiety and fear? Am I hearing that question right?
Yes, this is Robert. Yeah, in other words, what are some of the methods? Cognitively, client understands it, is very familiar with it, but at the same time, still continue to experience it.
Mhm.
Is it okay that I'm talking to you? I'm sorry, am I out of place, or should I be doing this in the chat?
Oh, no, you're good. Yeah,
Oh,
I'm glad you opened your
thank
mic
you.
to clarify. Thank you, Robert.
Okay, yeah, I was going to
Yeah.
put it back in there, but I didn't want to do that. So, yeah, they understand it cognitively, and they understand that this is a distortion, and they replace it with a more
Mhm.
rational thought. But yet there's a tendency to be hesitant about venturing out because of a sense of fear or something happening, but in reality, there's
Mhm.
nothing. They do a lot of exposure as well.
Mhm. Yeah.
I know there's a lot there, there's a lot, but just,
Right. No, you're good. Yeah, you're saying,
okay, thank you.
let's say they have anxiety and fear, they've done the cognitive work, and then they still feel the anxiety and fear. Where do you go
Yes, and,
there,
and,
right?
and they've been doing it for a few years, actually,
Mhm.
yeah.
Sure. And likely you're saying they're afraid to go out or whatever. There's probably an avoidance component. And in TEAM-CBT, we don't think the cognitive work alone is sufficient for anxiety. There's multiple treatment models for anxiety and fear, including let's first make sense of the anxiety, honor it through positive reframing. Why is it here? What's it trying to do for you? Let's work to understand it first. So that's the motivational model, and see if you actually want to change that. There's the cognitive work that can be helpful. And I'm seeing Sean now, he's putting probably some exposure can be helpful, even though I'm feeling the fear. What's one action I can take that I'm afraid to take that would be important for me? And act congruent exposure is what aligns with my values. What do I want to do if I didn't have this fear? So I want to actually go see my grandchildren. But because of the trauma I've been through, I don't want to connect with them or expose them. And so One step that I can take is actually make time to get out of the house, make time to connect and socialize. So that's exposure work. And then the hidden emotion work too, is another powerful tool to address anxieties and fears. So there's a lot of different angles to come about it. There's relationship work, communication training can help them with fears, anxieties, socializing. That is a really quick and dirty rundown of anxiety treatment from the TEAM-CBT perspective. And so if you want to learn more about that, there's a lot more other trainings out there, especially through the Feeling Good Institute and talking about addressing anxiety and fears.
Thank
Okay. I hope that answered your question some, Robert. Lots of layers to that. Okay, lastly, I'll go into Savannah's question and then I'll share with you the healing place. And then I have a drawing for a free spot to my Oklahoman conference that I'm just gonna do here. So it'll be exciting. You all could see who gets to win. One lucky Oklahoman gets a free spot into the training there. Okay, Savannah asked or expressed, I was surprised to find that my child self wanted to stay in the past. Yeah, that's why we asked them. We ask them, we want their permission. We don't just retrieve them and yank them out of there. And sometimes they have good reasons. So the child self wanted to stay in the past after we talked because she felt empowered and still wanted to be around for the beautiful parts of the past. I feel kind of moved by that. I think they have wisdom, like these inner parts of us have wisdom on what they want, what they need. We don't force them to go out there. And she's like, I'm good here. There's some beautiful parts about the past that I just want to cherish. And then you can take that message with you, right? There's beautiful parts of the past my child self wants to cherish, and maybe I can also honor that and cherish those parts as well. I really like where that went for you, Savannah. Okay. Thank you for sharing your great questions and especially your experiences through that. These tools really resonated with me because I think we haven't had enough exposure to time projection or ways to flesh it out, and also just spaces for slowing down, more presence, more mindfulness, because team's kind of like fast paced. Let's get through the tools. Let's get it fast. Let's heal in 2 hours. And I also find balancing it with some tools on like, let's slow down, let's connect with it to help create some healing and a different angle from what we currently have. Okay, and the next is the healing place. This is also another tool that I found to be powerful for clients with complex or attachment trauma. This is from Robin Shapiro. She's not related to Francine Shapiro, who created EMDR. She's just another Shapiro. Really does a lot of parts work. And her book, Easy Ego States, I just really love how she lays out some practical tools to help people heal. Oh, I just realized I didn't pin myself again for the recording. So let me do that real quick. Otherwise, others are just seeing a black screen. Okay. What's really cool with this tool is, so she's worked with some people who have been just neglected. They haven't had their needs met. They felt ignored, didn't feel seen, and also at times just weren't nourished because parents were either lost in addiction or lost in their own depression. And what she's found is once they go through the healing place exercise, it's helped some of her clients stop binge eating. And so in this tool, we actually have them have an ideal caregiver there with them. And in this place, this caregiver meets all of their needs. And so they just see and visualize that a child that's been stuck in that really hard time, and then have that protective caregiver, the ideal caregiver just meets all of their needs, is feeding them, gives them space when they need it, gives them love when they need it, hug them when they need it. And then she finds like, wow, my client stopped binge eating like within the next few weeks as they just allowed this more subconscious work to continue to take place. And in her book, it didn't have this component, but in the training, she added every minute. Okay, I get this wrong in reverse sometimes. Every minute in the outside world is an hour in your healing place. So by the time that we meet next week, 7 days would have passed in the outside world, but it would have actually been 420 days, over a year of getting your needs met, of getting love, of getting care. And that's just the instruction. She provides them and sends them on their way, and then they come back. And not only have some surprisingly been helped with their binge eating, it seemed for her, what she's witnessed is it speeds up the healing process through just allowing this corrective experience of getting your needs met, getting your attachment needs met, but even like nourishment, care, attention, appropriate boundaries. And there's instructions and all of that in the handout too. So it's a pretty cool tool. Okay. Okay, and let me just share it with you in the handout. And you have this with you in the email, but you can also just follow along if you'd like. And I'm just sharing with you some of the instructions. You can visualize it if it feels helpful for you. You could just listen along, whatever seems to resonate with your system right now. We'll just go with that. And this is the instructions for the healing place. So as you start some of the trauma work, by the end of it, you just give them these instructions. Right? So the healing place is for traumatized clients, especially if they can't recall experiences of safety, which is true for many abuse survivors. The idea of safety feels distressing. We just changed the name to healing place, and then you're building deeper safety by allowing them to connect with this ideal caregiver. Okay. So as you explain the healing place, allow for a lot of pauses for them to visualize, really feel into the experience, and that seems to help to enhance the power of it. But yeah, you have this exact script where it just says, imagine a healing place that's invisible to everyone but you. It can be a seashore, a forest, a place in the mountains, a place in the desert, really any place you want. And if you need to, in order to make it completely safe, it can even be off the planet. Totally up to you. And just process with them. What did you pick? What are pieces we can add to it that makes it healing? And then just wander around it. Make sure that it suits you. You can change anything you want and just make it yours. Okay, just allow you to walk yourself around there. If you need a kitchen, add it. You can add a magic refrigerator with cupboards with all the foods you love. You can add comfort foods. There's no calories in this healing place. And there's a different prompt for sexual abuse survivors that you can read through, but I'm going straight into the attachment figures safe place or healing place. And if you could have anyone, any being you wanted, someone or something to watch over you, protect you, and always be ready to respond lovingly to you, who would it be? Some people may choose Jesus, Bodhisattva, Obi-Wan from Star Wars. It could be a loving bear, a loving pet, super nanny from the show. some kind of angel, a best friend, a grandmother, Wonder Woman, anyone that you'd want. They'll be there for you 24/7. Who would you want in your healing place? Just breathe in a sense of safety and connectedness. And in this space, as you envision it for your younger self, know that they will feel loved all the time in there because this is their ideal caregiver. This ideal caregiver is friendly, protective of them, never ever scares or hurts them. And the ideal caregiver doesn't need to sleep. So they're always on guard and standing there to protect you. They're always available to respond to any happy feelings, any sad feelings, any scared feelings. They're there for you. And if your younger self gets angry, that won't scare them away. They can take it and they can be present and love on you no matter what. And when your younger self wants to play by himself, by themselves, they get to. Their wishes are respected. When they want to be held, when they have needs, they want to cuddle, the ideal caregiver will provide that as well. And no one and no thing will bother them while their ideal care figure is around, which is all the time. When your younger self is hungry, they'll feed them nourishing food. They'll make sure he stays well hydrated. When your younger self thinks that the people who hurt him are around, this figure will be there to make sure those people stay away. And that younger self knows things are different now. And just know every minute in the outside world is an hour in the healing place. So by the time that I see you again next week, your younger self has been in the healing place for more than a year, for 420 days, getting all of their needs met, all of their emotional, physical, spiritual needs met. The moments that you as a grown-up are working, taking care of things, entertaining things, every one of those moments, even when you're sleeping, your younger child part, your younger self is safe, held in their healing place, being responded to just the way that they need. The one thing that's different for sexual abuse survivors is they also add, imagine there's a healing pool there. And you can lay in there to heal the wounds, to heal the hurt. I think that can also be helpful for when there's been physical harm, physical abuse, just a healing pool that they can lay in when they need to, just as a healing place. And so that seems to allow to continue the healing work in between the sessions. It seems to allow just some of that subconscious work to continue to just flow through them. We're looking for corrective experiences that heals attachment, that creates a sense of safety. And that is the last of it. What thoughts or questions do you all have about the healing place? Oh, I like that. Ellie or Eli? I'm not too sure, but I think it was Laura Parnell who uses 3 figures: a nurturing figure, an inner wisdom figure, a protective figure. Yeah, you can have 3 figures, you can have them all rolled into one. We're just looking for these corrective experiences that seem to allow this new neural networks, just deeper healing to happen for people. I love learning from all of you. I haven't heard of Laurel Parnell and those 3 figures. That's cool. Any other thoughts or questions about the healing place? Sue's asking, does the patient check in during the week to this perfect place to watch the child? We just allow this prompt to go. They can check in with the child if they want to, if that feels helpful for their system. And the main piece is just allowing them to visualize that part of them that's been wounded, hasn't had needs met, that it has this space now that it can go to. And subconsciously, as time passes in the week, they're getting a year's worth of healing, getting their needs met, feeling loved, getting their boundaries respected, someone who can take their emotions instead of shaming them. And so we just know these are the components that helps people to heal attachment wounds and helps us to feel safe again, because those are all of our basic needs, right? To feel cared about, nourish our bodies, having our boundaries respected, having our emotions not push people away. Our emotions aren't shamed. Like, I can take any emotion that comes up from you. Dawn, you like the pool. I really like that too. Yeah, I really love that component, especially for some of my clients who've been through sexual abuse, and they talk about, I just feel dirty, I feel tainted, and then they can go into that healing pool, and it's very moving to feel like I can reclaim my body and get a healing, cleansing experience. If water is part of the sexual trauma, laying in the healing cloud is an option. Ooh, I really like that, Kathy. This is about catering the approach to your clients, right? Make the modifications. One tool is not going to fit for everyone. If water is a part of their trauma, do a healing cloud, do a healing, whatever, a healing tree that they can sit next to, whatever it is, a space in the earth that's healing for them. Yeah, love that. The health energy around trauma can drain into the water. Yes, there's visualization of that for them. I'll share that with you in the IFS trainings on just ways to unburden. They can release these burdens into water, into air, feel like a healing light comes into their system and heal it. That can be a really cool way to approach it as well. Okay, Kim's asking, do you repeat these exposures and is there homework? So if you look at the written exposure therapy, that's repeated like at least 5 times. For others, just going through like time projection, I don't usually repeat those unless it feels like there's something that's left unwitnessed and they need that. And then the homework for a lot of this is just as we're doing this work, there's likely thoughts, memories, sensations related to the trauma that can come up for you. And part of the work and the healing is to just allow them to come and to flow through you without trying to suppress, run away, and avoid. And that seems to allow the continuing of the healing. If you're doing anything else with team, you can do some homework with that. But a lot of these processes is just allowing the process to flow through without avoiding. Okay, and then without further ado, we have an exciting drawing here for my conference that's coming up in Oklahoma. So apologize for those of you who aren't Oklahomans. But if you're in Oklahoma, this will provide you 20 of your needed CEUs for the year. It's going to happen from March 26th to the 29th. And you can get 3 hours of ethics as well. You don't have to attend all 4 days. You can attend one up to all 4. And then you could just learn more about it here on teamcbttraining.com/conference. And now we're doing a drawing for people to win the spot. And then I'll copy the feedback form for you all. Would really appreciate if you can provide feedback about this training, what resonated with you, what can help it to improve. That really helps me. Okay. So let me go ahead and copy that link. And then we'll do the drawing here. It's really exciting. There's this cool tool. Let me see. Is that it? random name picker. Have you all seen this? I just enter in the names of the people who want to be entered into the drawing. And then it creates this awesome wheel here. And then we just click on it and let's see who wins the spot. It's a value of up to $449. And the winner is Summer Warren. Is Summer here by any chance? Maybe she ran off, but yes, Summer Warren is going to be a participant who can attend completely for free. So congratulations. And I'll email the link and everything as well. Oh, Mike, thank you so much for sending that out. Now I don't even need to do that. Oh, so appreciate you being here and helping with that. So yes, please, the link is now in the chat. And I really value and appreciate your feedback. I'm here for the next 5 minutes if anyone else has any other thoughts or questions. But this wraps up for today. TEAM-CBT and 3 tools for healing complex trauma. So thank you so much for attending, for participating. I hope you find it helpful. Sean will take the free ticket from Summer. Okay, we'll hand it to you, Sean. Summer's not here anyway.
Thanks so much, Tyann. Well done as always.
Thank you
Take
so
care.
much, Mike. So appreciative of you being here. Thank you for your help.
Thank you, Ty.
Thank you, everyone.
Yes, thank you. Thank you so much. That was a wonderful training.
Yes, thank you so much for being here. I'm glad it
Yeah.
resonated with you. Yeah, people are enjoying the experience. And just open your mic if you have any other questions. Yes, George, the recording is going to be available, but it's only sent to people who registered just because there's that recording of the personal work, and I wanted to be respectful of that for her.
Tyann, again,